to say hello and I guess kick off our New York State presentation today. I'm Nicole Thornton. I'm the Senior Director for Field Development in our New York City community. So the local field staff partner for the 5 boroughs. And I know there are some other of my New York State market leads and executive directors probably on this call too, who cover our other local communities. Just to start us off, well, this is our quick note about legal and our information on resources and services. And we quickly went over our mission, which I'm sure most of you are familiar with, but the work that we're doing at Autism Speaks is really to promote solutions across the spectrum and throughout the lifespan for individuals and their families. And we're doing this through advocacy and support, increasing understanding and acceptance of people with autism. So World Autism Month is the perfect time for us, and advancing research into the causes and better interventions for autism spectrum disorder and related conditions. And before I turn it over to Judith, as a field staff partner, we wanted just to take a moment to let everyone know what we'll be doing tomorrow afternoon at 1 p.m. in New York State. It's 10 a.m. Pacific time. But I hope that everyone will consider joining us for our Steps for Kindness. This is an event that you can do from home. We're encouraging folks who participate to take 5,400 steps tomorrow in support of the 1 in 54 U.S. kids with autism. And that's really wherever you are and however you can. So every step does count, but it's really just a moment for us to come together as a community and join this nationwide celebration and, be a part of our Be Kind campaign. We'll be doing at 1 p.m. and opening ceremony, just a quick 15-minute Facebook Live to send everyone off for their Steps for Kindness. And you can do this from the safety and comfort of your own home. So if you lapse around your living room, perhaps some steps around your backyard, or just a safe walk around your block or neighborhood walk that's appropriately socially distanced. But again, just a chance for us to come together and show our community's relentless commitment to creating a kinder and more inclusive world and being there for one another, sort of no matter where we are. And I think this is a really nice way for us to close out our different looking World Autism Month for April. But I won't take up much more time. And without further ado, we'll turn it over to Judith Orsetti, our State Director for Government Affairs, or Director for State Government Affairs. I'm sorry, I tongue twisted that, but I will put myself back on mute and hand the reins over to you, Judith. Thank you so much.
Absolutely. All right, thank you guys so much for joining today. I know that many of you probably have one Zoom after another, or you're doing telemedicine, telelearning, or you're just trying to get through another day of this different experience that we're all facing. I think in the autism community, we're used to unexpected twists and turns, and we're used to adapting in many ways. We're definitely a resilient bunch, but this takes that to a whole new level. I feel like we're all walking down a new path together, and we have different mechanisms of getting there. Some of us are walking, some of us are crawling, some are running, it may be intermittent, some of us may be driving in a Rolls Royce down the road. It's just a different journey and different challenges. And so today we want to talk about some of those challenges, and then also talk about ways we can act right now to try to make a difference in the short term. And we're going to keep having these conversations over the long term too. We know that you who have loved ones who are on IEPs, that's just been totally blown out of the water. Day programs have been closed, clinics are closed. We're all trying this new thing called telehealth. Parents and caregivers and siblings, family members need mental health supports. For people with autism, there's a lack of connection to the community and opportunities that they're used to participating in. My son Jack is 16 and he has autism and a severe intellectual disability. And I think pretty much every Saturday night for the last decade, we've been at Outback Steakhouse because that is his community connection. Those are his people. And he looks forward to going to Outback every Saturday. We can't do that now, which may seem like a small thing to some, but to our community, people like Jack, it's huge. For those who have jobs that they've worked so hard for years to get and to engage with the community and to be paid, they're not there. You know, that has been disrupted. Families are in desperate need of respite, living that 24/7 life, trying to provide care for someone with autism who might be extremely anxious or who is experiencing challenging behaviors, self-injurious behaviors. That's so hard. And then there's the whole other layer of the fact that our population is prone to wandering. And so respite now more than ever and safety is so important. Routines are gone, or maybe we're creating new, very limited routines. Families are losing employment, they're losing income. I mentioned challenging behaviors already. And then of course, there's the whole deal with healthcare and what do you do if you need to go to the hospital, if your loved one has COVID-19, how do you access healthcare in this new time? So these are all the things, or many of the things that are shaping the advocacy that we're pursuing on the federal and the state level. And if there are things that we're missing on this list, we want to know that. So feel free to share that in the Q&A or the chat box. I will tell you that you are all on mute. And if you want to be unmuted, you can type your questions in the chat box or the Q&A, or you can raise your hand and we can unmute you. We will be doing questions addressing the chat box at the end of each section, and we also will be sending out information after the webinar. And I do want to mention when we have these Zoom meetings, it's very difficult. We want to answer every single question. And many of you, like me, we have really individual questions about what's happening on our IEP or what's happening with our services from OPWDD. It's questions that are specific to your life and your community, and they're so important. But we don't have time, unfortunately, to get into the weeds. So if we don't answer your question specifically, please contact our Autism Response team. The information is here. You can email them at help@autismspeaks.org or call them at 1-888-AUTISM2. We do have support available in Spanish as well. And as I said, we will be sending out information to all of you after this, and we certainly are going to do our very best to answer every question, but we may not address more individualized questions verbally during the webinar. All right, so enough intro. Now I'm going to actually go over the agenda with you. You all know Nicole from New York City, who does a wonderful job there with our community. We have walks in upstate New York. We have walks in Westchester, Long Island, Rochester, everywhere across the state. We're part of your community. So thank you, Nicole, for being part of the field welcoming everyone today. Dave is going to represent our federal team. They're in DC and they're working every day to make sure the autism community is fully represented in legislation that's passing Congress by the minute, it feels like. I'm gonna talk with you all about what's happening in the state of New York, and also we have some amazing lobbyists in Albany who represent Autism Speaks, who work all the time on our behalf, and they're going to be sharing about what's going on in Albany. And then finally, we've got community outreach information from Jenny Green. Many of you know Jenny. Please hang in there till the very end because there's lots of good information here to share if you're able. Okay, so with all of that, I'm going to now turn over to Dave, who has like by the minute information about what's going on in DC.
Great. Thanks, Judith. And it's good to be with you all. Yeah, as Judith mentioned, my name is Dave Sikowski. I'm Senior Director for Policy and Federal Government Affairs and based out of our DC office. And so what I'm going to try to do is provide a pretty high-level overview of what has been going on in Washington in terms of the various bills that have passed related to the COVID pandemic. And then talk about where things may be going with additional bills, and then kind of talk about some specific concerns for the autism community and what we've been doing in terms of our advocacy. I know I'm not going to be able to get to every detail and every question that you may have in terms of my overview here, so we welcome questions in the Q&A box to try to get to as many now, and if we don't get to them on the call today, we will be sure to follow up. So kind of starting at where we've been in terms of federal COVID legislation and what's already passed. One note I'll make is DC and Congress, there's always some type of lingo or acronyms for things. And so the way that people have been referring to the different bills that have been passed are COVID-1, COVID-2, COVID-3. There's actually a COVID 3.5 that I'll talk about in a second. And so I just noted that here on the slide. So in case you're confused as to what I'm talking about, that's what it is. So the first bill that passed Congress related to the COVID crisis was on March 6th. It was the Coronavirus Preparedness and Response Supplemental Appropriations Bill. That was considered COVID-1. It provided about $8 billion in emergency funding for the public health response, essentially, and several other provisions. But it was really the first tranche of money and first response to the crisis, but didn't address a lot of the issues that individuals and families would be facing, and that and some of the larger challenges in the country. So several weeks later, like 12 days later, actually, Congress passed the Families First Coronavirus Response Act. Importantly, this included an emergency paid sick and family leave provision that I know will be important for a lot of families and individuals throughout our community, and so that was included in there, as well as some tax credits, some free like provisions for free COVID-19 testing were available, of course, because I know that's of course been problematic, and then expanding food assistance and unemployment benefits, and there was an important increase across the board for Medicaid funding as well. The large bill that you all have probably heard most about related to this crisis was the Coronavirus Aid, Relief, and Economic Security Act, also known as COVID-3, or the CARES Act. This bill provided $2 trillion in funding for a variety of things. Most importantly, and I think were the benefits for families and individuals. So the stimulus checks that you all have heard about or are being described as economic impact payments by the IRS. That's why they're referred to like that here. And that's $1,200 for every American up to a certain income threshold, and $500 per dependent under age 17. And those payments will be distributed automatically to filers, tax filers from 2018, if you filed in 2018 or 2019. And while there had been some issues raised about non-filers, specifically just individuals who didn't have enough income to file or didn't need to file taxes, or are on supplemental security income, SSI, or Social Security. For SSI and Social Security beneficiaries, there was a fix that happened to ensure that their payments would go out automatically. I'll get to that more in a few minutes. This also included the increased unemployment benefits, so the additional $600 per week that was included. was in this bill. Hundreds of billions of dollars to address the public health response, to going out to hospitals, physician offices, et cetera. Assistance for small businesses and other employers to retain employees and keep their businesses going. This is the Paycheck Protection Program that's been in the news a lot lately. This was essentially $350 billion made available to small businesses to keep people on payroll and in the form of a forgivable or potentially forgivable loan. It ran out of funding quickly, which has led to some additional congressional action we'll talk about. Billions of dollars for schools. This was distributed or was included in three ways: money for higher education, money for elementary and secondary education, and then a discretionary pot of funding that would go to governors to determine, as they see fit, essentially, how they want to distribute. Lastly, the legislation extended the Money Follows the Person program through November, which is, of course, very important for our community. Judith, if you could go to the next slide, please. So a few issues we wanted to just touch on that were of note to our community: the economic impact payments and SSI. So, this is what I was talking about before. After the law passed, there was a lot of concern about non-filers, and particularly those on SSI, being able to get the benefit of these payments. And initially, there was this rigmarole, and a portal was set up to allow people to enter their benefits. Of course, enter their information. And of course, this is just an additional burden, and so there's a lot of advocacy, and fortunately, that was changed. And one thing to note as well is that your receipt of the economic impact payments does not affect eligibility for any federal program. So I know that's been a concern that's been raised, and the law was specifically written in a way that wouldn't jeopardize that for people. There were some other, there are some other specific issues. I mean, I know we've heard a lot from the community about the fact that dependents, the only dependents under age 17 are eligible for the $500 credit. And I would love to be able to have the explanation or have been a fly on the wall to understand why it was drafted that way. But I don't have an exact answer, but I do know that there is some advocacy in Congress right now. There are a number of members of Congress that are interested. There's a bill to try to address this. So I know it's been a concern that's come up for many, and it's just how they ended up drafting the law. So happy to talk more about that in any other questions that you have about the impact payments. Distribution of education dollars. So as I mentioned, there were several different tranches of money. For elementary and secondary education, there's about $13.2 billion that will be sent out to the states and then distributed to local education agencies through formula funding. And I know Judith will talk about this as well. Autism Speaks is just trying to ensure that, when those dollars go out to the school districts, that this money is being spent in a way to ensure that our community is able to receive some of the assistance from this. That of course, the distance learning is opportunities. Of course, we want everybody to be able to have access to them, but they're in no way a replacement or for the comprehensive types of education that in-person schooling provides. And so whatever additional supports can be provided now are important. And so I know Judith will talk a little bit more about that as well. Going on to the next point, the IDEA waiver report. As the COVID-3 bill was being put together, there was a lot of concern that that legislation would include a waiver or the ability for the Secretary of Education to waive IDEA requirements. And Autism Speaks spoke out against this. Many others did as well. And ultimately, there was no waiver included within that COVID-3 bill. What ended up being included was a requirement that the secretary issue a report within 30 days of passage, so actually it should be coming out soon, of any waivers that she sees as potentially necessary moving forward. That report would be submitted to Congress, and then it would be up to Congress to then take action. So there would, if there was going to be any additional waivers, it would take that congressional action. There's a lot of opposition to this. We have spoken out in opposition to IDEA waivers, and I have a letter we can share that we signed on to that kind of outlines why and the principles that we agreed with, that many in the disability community also had signed on to. Lastly, in terms of the emergency paid and family leave, this is provided to help families both dealing with, directly dealing with coronavirus-related challenges, as well as the closures of schools or daycare centers for their kids. But notably, one of the things that was left out, at least explicitly, or it was ambiguous, I should say, it was what happens, or what is the eligibility for caregivers of adults with disabilities whose regular source of care, a day center, another service provider, et cetera, that's no longer available. We wrote to the Department of Labor to ask them to interpret the law this way, that it should be inclusive of everyone, including those in these particular circumstances. And fortunately, when they put out their rule related to the bill, they did include those caregivers. So I would just wanted to point that provision out. If you go to the next slide, please, Judith. So where we are right now. So just yesterday, the House of Representatives passed the Paycheck Protection Program and Healthcare Enhancement Act, also known as COVID 3.5. It passed earlier in the week in the Senate, and I think the president should be signing. I mean, if he hasn't signed it while we're on this call, he should be signing it today. And this is really an interim bill. As I mentioned, the Paycheck Protection Program, that big pot of money available for small businesses for forgivable loans, ran out of money fairly quickly. It needed to be replenished. And so this bill is very targeted to just doing that, and then also providing some funding for hospitals and testing, and coronavirus testing. And so, this isn't to be seen as like the next, CARES, but the COVID-3 bill, where there was like a $2 trillion amount, even though this was $500 million or so. We anticipate that there will be additional legislation in the coming weeks or month that will address some additional relief. So that's where I mentioned here the COVID 4 or 5. We don't know what the timeline is yet, or what will actually be in these bills. Both the House and the Senate have said that they're not going to be back until May 4th at the earliest. But it's kind of anticipated that this could be pushed back even further. And then in terms of what will be contained in these bills, it's very unclear. We think that there could be money for the public health response, additional economic relief for individuals and small businesses, money for state and local governments who are hurting in terms of the financial picture as it relates to this crisis, is definitely going to be a huge topic. It was in play for this COVID 3.5 bill, and ultimately was not included. And we know that this, of course, has ramifications for education and all kinds of other services as well. More money for education, additional nutritional assistance, additional housing assistance. There's been a lot of discussion around that. The post office finances, it's a huge concern right now. And then potential for infrastructure investment as a form of stimulus. If you go to the next slide, please, Judith. Thank you. So, throughout this, I mean, we on our advocacy team, federal advocacy team, are always in touch with members of Congress on a variety of different topics. Over the past few months, of course, we've had to focus on the COVID crisis, its impact on the autism community, and what we can do to effectively advocate for some of the priorities that would be most helpful. And so we've put here a list of just some of the things that we have been advocating for. So additional funding for home and community-based services. And this could be used in a variety of different ways, but just ensuring that more people have access, that that there's an ability to pay workers, provide the right PPE that is needed for caregivers. All of this could be, all of this could come under that home and community-based service bucket, and we've been really pushing hard for that. Expanding access to telehealth services. I know Judith touched on that already in terms of how there's just been such a big shift to this, and ensuring that the appropriate care and access is being provided for our community is so essential. Additional funding to meet the educational needs of students with autism. We are working not only on ensuring that the money that's going out now is helping our community, but also going forward. We anticipate, we hope, right, that school is back in session at some point, and that we can be able to transition back in, but there's going to be a huge amount of need in terms of making up for lost time. And we think that we should be providing in advance money for schools to provide those compensatory services, so that there's at least the ability to provide those types of things right when students get back. Protecting the rights of students under IDEA, we touched on already, that we're continuing to be vigilant on that front. Same thing, ensuring that caregivers of adults with disabilities are afforded the same rights as those caregivers of children, both in this paid sick and family leave and elsewhere. And lastly, we applauded the Department of HHS put out a bulletin to states and to healthcare providers, saying that there should be no discrimination in treatment decisions or care allocations based on disability. We have a statement that's linked there, and continue to advocate on that. Lastly, I'll just note that Congressman Smith from New Jersey, Chris Smith from New Jersey, and Congressman Mike Doyle from Pennsylvania are congressional co-chairs of the Autism Caucus. They've been staying engaged with congressional leadership and with us, and have sent a letter as of just this past week to congressional leadership advocating for many of the priorities that are mentioned on here, and for additional support for people with autism. So I know that was a lot that I just covered in a couple minutes. I'm happy to take more questions, or take any questions that you have, and we'll address anything that we don't get to now offline. Thanks, everybody.
So I know Kelly Hedrick, who's our Senior Director of Grassroots and State Government Affairs, is monitoring questions. Kelly, do we have anything?
We do, Judith, thanks. We have two that we'll hold for the after the state section, because you may either cover them or be able to address them right after they're of a state nature. The one federal that we have is, Dave, when is the IDEA report expected, and where can people find it when it's out?
Sure, good question. So the COVID-3 legislation passed on March 27th. The report is due 30 days thereafter. And so presumably it would be coming out shortly, right, within the next few days. Deadlines aren't always met in terms of reports that are required. I would anticipate that this would be something that would come on time. So we expect it either between now and in the next few days to be coming out. We would also anticipate that the Secretary of Education would post this on the Department of Education's website. I can tell you that we will certainly be reviewing it and putting out some materials related to it. I don't know if it would be the day that the report came out, to be honest with you, because I think we would want to take the time to understand what's in there. But if in that interim time you can't find it, please don't hesitate to reach out to us if you heard that the report came out, and we'll be happy to provide it a link or be able to provide those resources to you.
Great, thanks. That's it for now.
Thank you.
Thank you, Dave. Thank you, Kelly. And thanks for the good questions, everybody. So now we're going to move on and talk about what's happening in the state of New York. And up first are our lobbyists. Autism Speaks has contract lobbyists in Albany from Farrell Fritz. So Mark and Vanessa, if you would give us the scoop about what's going on there, I would appreciate it.
Sure, this is Mark. I'll start off and Vanessa will jump in. So it was actually a challenging year before COVID-19 from a budget point of view, and COVID-19 has only made it worse. The governor came into this budget year with a $6 billion deficit. Shortly after COVID-19 hit, there were estimates that increased that to 10 to 14. Now I think everyone agrees that the true impact is not yet known, and that's reflected in the budget that was ultimately enacted. But just to give you a sense of how the stage was set at the front end, the governor took actually two very significant actions prior to really the beginning of budget negotiations this year. One, since 2011, the governor has had extraordinary powers under what is called the Medicaid global cap. Essentially, a cap is set on the growth of Medicaid every year. When that cap is pierced, that triggers a variety of extraordinary powers that the governor has relative to Medicaid, not terrifically unlike the powers he has under a state emergency, as we're discovering. But at the front end of the year, he declared the cap pierced and did take an extraordinary action. He actually reduced Medicaid reimbursement essentially to all providers by 1%. And that was before negotiations even started. And then he convened a second Medicaid redesign team. Now, many of you will remember in 2011, when he was first elected, there was a very strong focus on changing the cost curve under Medicaid, and he assembled this blue ribbon commission to advise and recommend cost-cutting measures. He did that once again, and once again, it was on a very short time frame. It was convened earlier in the year with the assumption that recommendations would be made that would be adopted in connection with the adoption of the 2020 state budget, which was due by April 1. And that entity convened and recommended a variety of cost-cutting measures that further complicated the budget process. And then, of course, COVID-19 hit. Vanessa, do you want to talk a little bit about how budget negotiations went after that point?
Sure. Good afternoon. Hope you can hear me. Yeah, so essentially the already difficult budget negotiations process was halted in mid-March once the uptick in COVID cases hit. It's usually, well, the New York State budget deadline is April 1st. Typically there is a great number of negotiations that take place both privately and then some also public hearings that advocates like ourselves could go to and attend to really kind of keep up to speed in terms of what the big picture, big budget items are. Unfortunately, the Capitol was closed in mid-March, and then advocates were forced to then, make their traditional budgetary asks and pleas through either telephone, email, and over Zoom. So it was quite a different process. Literally, the Capitol was closed to anyone but essential employees that were involved with the process or deemed essential to state government operations. In the end, New York State adopted a $177 billion budget, which gave the governor great flexibility to adjust spending based on revenue that's coming into the state over, the course of this fiscal year. And many, but not all, of the Medicaid redesign team recommendations were adopted. And various state agencies and the governor's office are now working on implementation.
Gotcha. And then all of this, of course, ended up taking a backseat to the COVID-19 response. As pretty much I think everyone in America at this point knows, New York, and particularly the downstate region, is the epicenter of the pandemic in New York. And the governor has taken aggressive action to respond. This actually began with a fundamental change in his emergency powers. Previously, in the event of a state of emergency, the governor had the power to waive statutes and regulations that might get in the way. Early legislation that was done in the crisis gave him the power not only to do that, but also to direct specific actions. He has not been shy about using those powers, and in a few minutes, Judith is going to talk in some detail about some of the key actions taken that affect the autism community. But in the process of all this, I think it's fair to say he's really become a national leader. His daily briefings have served as a guidepost for people across the country. And, I know, for a number of people, certainly it's true of my family, it's become, I think it's fair to say, the primary source of information at this point, at least primary source of reliable information. The good news is that the peak of the pandemic seems to have passed in the New York City area, and the focus now is on maintaining efforts to make sure it doesn't flare up again. Monitoring potential peaks elsewhere in the state. The governor's been very clear that the state is not monolithic, and there's a very strong potential, if not likelihood, that other parts of the state are going to peak at a later point. There's also a possibility that if current efforts are not maintained, there could be a resurgence downstate. And everyone now is very much focusing on a plan to restart the economy. So, Vanessa, do you want to talk about what comes next?
Sure. So the big question is what comes next? DOH has been charged by the governor to develop a statewide diagnostic and antibody testing protocol to better track and understand the virus, to identify people, and then eventually identify regions and industries that can go back to work. Throughout this complicated budget process, the New York State Legislature has adopted a new online virtual kind of technology-based remoting process and procedure that they never had before. So they have the ability to come back into session if they so choose. Right now, we're obviously monitoring very closely. It's uncertain if and when they will come back, but there is some talk about them coming back to deal with some COVID-related issues. And in general, the state and private sector are just trying to develop plans and adjust to the new normal. One big key piece that is on the horizon, hopefully, is that the governor has repeatedly asked for additional federal assistance for New York State due to not only the substantial amount of expenses related to combating and preparing for COVID, but also because of the significant decrease in revenue. So certainly, as was stated earlier, there our governor and a number of other governors that have been, adversely, significantly impacted, and the individuals in the states are asking for additional assistance, and hopefully there will be another stimulus package coming together at some point soon. I think if the state could get additional resources, that would certainly help our overall perspective. But the governor has indicated that if those funds don't come to fruition, he would unfortunately be forced to look at making cuts, particularly in education and healthcare. So I think we're all obviously closely monitoring, and we'll report back as additional things develop.
Thank you, guys. Very informative. I hate that we're using the word unfortunately so much, but I think it's just a reality right now, and we want to make sure everybody has up-to-date information. So in response to this unfortunate time, Autism Speaks has set some priorities on the state level, things we want to focus on. Vanessa mentioned healthcare. We're also worried about those home and community-based services. And then, of course, special ed, early intervention, how is that being affected? How is that affecting people with autism and their families? And telehealth kind of is an underlying component of all those things. So one thing we've been monitoring and been involved with is what's going on with Medicaid. And Medicaid provides different kinds of services. They provide waiver services like the kind you get from OPWDD, and they provide health care to people. It serves as their health insurance. And so one of the things that was available early on during this crisis were waivers from CMS. And CMS is the federal agency that oversees Medicaid federally. They provided 1135 emergency waivers that provides flexibility on the health insurance side of Medicaid. And so, for instance, prior authorizations aren't required, pre-existing authorizations are extended, things like that. And providers from other states can be enrolled to try to meet the need of, just the tremendous impact on the healthcare system in New York State. And we will be providing the webinar to everyone afterward. And so there is a link to that 1135 waiver if that's something, you need more information about. As I mentioned, telehealth is a component of healthcare. It's, a component of education, waiver services. So another thing that we've been focusing and advocating around is telehealth services for our community. And so the Department of Financial Services, Department of Health, OMH, OASIS, OPWDD have all signed on to telehealth visits, and they can't restrict really in any way. They can't pay lower rates. It needs to be provided as medically necessary care or services at the same rates. We do know probably with our community, people aren't going to be accessing as many hours just because telehealth is a different type of experience, but at least that provision is there and all the agencies signed on early on. Another thing, and I know I'm getting really wonky, if you all need to stand up and stretch or do something, please feel free, because I know this is a little wonkish. But for those of you who get services through OPWDD, there was a process there too that CMS, the federal agency I mentioned before, provided just to try to allow some flexibility in those services you get from OPWDD, those waiver services. And so it's a process called Appendix K, which I had not heard of before all of this, but states can utilize Appendix K when there's a natural disaster, a national emergency, things like that, a crisis like COVID-19. So New York did submit an Appendix K application, and it was approved on April 7th, and there is a link to it in the presentation, but some of the things that the Appendix K allows for in your waiver services, services can be delivered in an out-of-state or alternate site. Staff training and qualifications are waived just so they don't hold things up while people are in crisis trying to access services. Timeframes are extended for level of care assessments, plan of care reviews. Person-centered planning is modified so it can still occur. There's options for retainer day payments for community habilitation, day hab, and pre-vocational services. And there are other things too. I'm not going to read the entire list to you, but the bottom line is it just provides some flexibility in those waiver services that are meant to help families get through this time while they're in the community, very much in the community, in their homes. Some additional things that we're hearing around healthcare are related to people actually being able to have someone with them if they're admitted to the hospital during the time of COVID-19. And this is an issue that's coming up nationwide. Dave mentioned earlier that the U.S. Department of Health and Human Services, the Office of Civil Rights federally, came out with a bulletin saying you can't discriminate against people who have intellectual developmental disabilities. Their care cannot be rationed. It's sad that that even has to be said, but the federal government has been clear about that. States are doing different things though. The fortunate thing is that New York State issued a bulletin And it actually has specific information in it about people with intellectual and developmental disabilities. And so if you're a person with autism, or you have a loved one with autism and they're hospitalized, and it may not even be because they have COVID-19, let's say they do. If they have COVID-19, they have the right to have a caregiver or someone with them to help them advocate. And so the caregiver certainly has to comply with, testing and wear PPE, things like that, and comply to be safe. But New York State has been very clear that this is important and it's allowed. So New York is one of just a handful of states who's taken this position right now. There are a lot of other states that are trying to do this. So you are ahead of the game in that regard. An issue that we're hearing about from families is for those who get services from OPWDD, many people are not able to access those during the school day because there's this tug of war between what's allowed during school hours and what's allowed outside of school hours. And can you bill the federal government at the same time? So that's something that we're monitoring and we're advocating around. In other states, this issue has arisen and it's been resolved so that people can access home and community-based services like you do through OPWDD during the school day. This is a crisis. Families need help now, and so they need access to care during that time. So I just want you to know that that's something that's important that we're monitoring. With regard to special education, SED did release a memo pretty early on, March 27th, and they said, students with disabilities must be provided with a free and appropriate public education. This is one of those situations where it seems SED is kind of, building the plane as it's taking off, and still while it's at 30,000 feet, there's a lot of inconsistency district to district. And a lot of confusion about what a free and appropriate public education should look like during this time. So Autism Speaks is advocating around this. We want families to have as many services as they can now from a special education, early intervention perspective as well. And Dave mentioned earlier that there's money coming down from that federal legislation, the COVID-3 bill. And so New York State, for instance, got $1 billion for K through 12. And they got $797.6 million for post-secondary higher education. And then Governor Cuomo also received $168 million, and that's at his discretion to be used for education. So Autism Speaks is advocating that that discretionary money that he consider, and this is already happening, but we want to make sure he considers and continues to work on acquisition and dissemination of hardware, software, communication devices, assistive technology for families. We know that's quite a disparate situation, what families have access to, what their Wi-Fi looks like, what their equipment looks like. And so if families don't have the appropriate technology, they're not going to be able to access special education. We're super worried about transition. We're worried about it on both ends. So when kids are transitioning, when the little ones are transitioning into special ed out of early intervention, and when they're older and they're transitioning out of special education off that cliff into the adult world, what's happening with them, and we really want to make sure that for those who need additional time and need the opportunity to transition and plan, that is going to be allowed and that funds are allocated to support that. And the other thing that we're advocating around is just making sure there is funding as part of this governor's discretionary fund, and also any funding that comes down moving forward out of those COVID bills that keep passing. But we want to make sure those services that you're not receiving right now are funded as soon as possible. And I know there have been some specific questions about what different school districts are doing and localities are doing around this, and what is extended school year going to look like? What does all this mean from a timeline perspective? We're encouraging people to keep a log of services that you're missing. Just keep an ongoing simple log to document what you're not receiving. Pursue as many services as you can right now, and don't be put off and told to wait. Like, ask for the services now, keep asking, but you certainly want to keep a record of what you're missing. So down the road, when there's an opportunity to pursue compensatory services, you'll have a record of what you missed. So just some information around that as well. We want to be here for you. We want to support you. New York is a diverse community, and there's a lot of wonderful autism organizations on the ground working on behalf of our community. We want to keep you updated to let you know what's happening on the federal level and the state level. So please follow us on social media. The information's right there. And then also go to our website, autismspeaks.org. /advocacy. You can sign up for advocacy alerts there, and there's all sorts of information about the COVID bills, federally, state information that you can read on the website if you really want to dig deep even further. So I'm going to stop right there. I know we're talking at you a lot. I hate that. I wish there was more interaction, but let's stop and see if we have questions we need to answer. Kelly.
Okay, thanks, Judith. Some of them you addressed, and I have let people know if they have any follow-ups in addition that they can ask those. This one has a federal, I think, and a state element. Do we expect the next funding request for education to specifically address the compensatory services and supports that will certainly be needed for the majority of students with significant needs?
Dave, I think that's for you. I
Sure.
vote yes. I think it should.
Yeah, we are very much in agreement that this is something that should be prioritized. It's something we've spoken with our congressional champions about, and something we're going to continue to advocate on. As I mentioned before, it's really clear as mud right now as to what exactly is going to be included in any future legislation. But I can tell you, we are bringing up this specific point with legislators, and our champions get it. And I think it's just continuing to make the case with other members of Congress, with congressional leaders, et cetera, as to why this is important. So they understand that, this is really what's needed, or part of what's needed, at least for when our students return back to school.
Okay.
Thanks, Dave. There are a couple that are pretty specific around reimbursement. So this, Judith and Mark and Vanessa, this may be for you to be aware of and consider if we need to do anything. CMS gave flexibility on DSP in the hospital, but it seems like the state has not issued necessary rates and codes.
Okay.
Yeah. The visitation policy is about what the hospital permits, not actual payment. The same person says time flexibility on ComHab. You have authorization for what's been allowed, but that has not, new authorizations have not been fast-tracked yet. So.
Got it. So the implementation of those flexibilities is just not working. Okay, good to know.
Let's see. What about children who receive the Medicaid waiver for family support services under the age of 8? Our respite care programs have stopped, and our $1,000 voucher seems up in the air.
Oh my goodness, I would need to look at that more specifically. I don't want to give bad information.
Okay.
Otherwise.
Okay. There's a update that was shared on the hospital visitation policy that's in the Q&A, so we can share that with folks along with these materials. I think in the interest of time, since we have another section, any of these that have not been answered, we can try to address in the offline.
Yeah, and we will. Good questions, definitely. New Yorkers always have the best questions. They're on it. All right, so let's move forward quickly. I'm gonna turn it over to Jenny Green, and she's gonna talk with you about resources that we have at Autism Speaks right now to help families and individuals with autism as they are navigating this new path. So Jenny?
Absolutely, and you can go to the next slide. I wanna spend this last few minutes just to share some of the COVID-19 information and resources, because we know that many families with autism are being directly impacted in very significant ways. So you're experiencing disruptions in vital services and also coping with that uncertainty of what comes next. So in these trying times, you may experience some of these changes and challenges listed here, or you may be experiencing all of them. So we just really want you to know that we are here and we're committed to supporting you and your family. So Judith, if you could go to the next slide. We mentioned this earlier, but I just wanted to elaborate a little more about the Autism Response Team. So our Autism Response Team are those staff members that are specially trained to provide personalized information. They also can provide guidance and resources to family members or individuals on the spectrum. The Autism Response Team they can answer questions, they can connect you with the tools and resources, and just help you find any autism services and supports in your local community. And I know, Judith, you did touch on this earlier, but I did want to mention again that they do have a dedicated toll-free number that is dedicated to just Spanish language. And you can reach out to them either via phone or you can simply email them at help@autismspeaks.org. So if you could go to the next slide. So you can actually utilize our informational videos that we have. This is actually just a snapshot of a short video that was created by our Autism Speaks Director of Lifespan Services and Support. Her name is Ariana Esposito. She's also a board certified behavior analyst. So in this particular video, Ariana actually provides tips in developing new school routines at home, and especially those for young children with autism. And this is just one of the videos that can be found in our COVID resource section. Next slide, Judith. So as I've mentioned, we do have a special COVID-19 section on our website that is updated regularly. It's providing information and numerous links to resources. Listed here are a few examples of the resources that'll be found on the website, and I really encourage you to please check this site regularly and share this link with everybody who you might know that would benefit from these resources. So when you go to our main page, which is autismspeaks.org, you're going to see a gold banner pop up across the top of the page. Clicking on this banner will actually take you to where the COVID-19 related resources are. And here you're going to find links to numerous resources divided into topics, such as families, adults on the spectrum. We have a link for educators and health professionals, and we also have an advocacy link as well, like we're talking about today. I did want to mention that our resources are provided in many other languages as well. We have some examples of the resources you'll see listed here, such as dealing with school closures, or what should the autism community know about the corona outbreak. Another great resource is to visit our Facebook and Instagram channels. I encourage you to go and join your local Autism Speaks Facebook group in your area. And I just wanted to, on this slide, lastly mention that earlier this month, we launched a really great new resource. The Autism Certification Center and Autism Speaks teamed up to make over 30 hours of online video learning available to our autism community at no cost. And this is until June the 1st. So next slide. And just lastly, I know we've been COVID specific about our resources, but I did want to mention that there are many other resources that Autism Speaks offers. On our main page, you're going to actually see a help and information tab. And when you hover over this topic, you're going to take a drop-down box and just simply click on information by topic. And then you're going to see this screen here that we're showing. And to help with your research for support, we've organized the resources and information by category, such as financial planning, safety, technology, transition to adulthood, just to mention a few. So that's all I have to cover, Judith, so I'll turn it back over to you.
All right, thank you so much. And we're really at the end of the hour. So I want to thank you all for taking time to join us today. If you have questions for Jenny about those resources, you can email us at help@autismspeaks.org, and we will be back in touch afterwards. Thank you so much, New Yorkers, for taking time to join together today to talk about advocacy with us. Please stay safe and take good care of yourself.